Remember to subscribe, and hit the bell icon, to never miss an update from Dr. Mike Baby Care Channel.
Your pregnancy. Week 38. At 38 weeks pregnant, your baby is nearing full term and complete maturity. You may literally be breathing a little easier as baby moves lower into your pelvis, reducing upper abdominal pressure. That said, just getting up to get a glass of water may feel like a chore. Your baby's development at 38 weeks. At 38 weeks, your baby is about the size of a winter melon. Your baby's eyes right now are blue, gray or brown, but once they're exposed to light, they may change color or shade. By the time your baby turns 1, you'll know their true color. By week 38, your baby is shedding the soft, fine hair, known as lanugo, that covers their body in utero. Most of this hair is typically gone before a full-term baby is born, although some hair may remain on the baby's shoulders and arms. Your baby's lungs have strengthened and the vocal cords have developed, which means she's ready to communicate through wails and cries. After your baby is born, his first few bowel movements will actually be a substance called meconium. This greenish-black, sticky form of poop starts to build up in his intestines while he's still in the womb, and is formed from waste materials such as dead skin cells and lanugo that's starting to be shed. 38 weeks pregnant symptoms. Common 38 weeks pregnant symptoms have everything to do with being really pregnant. Your big baby is almost ready to arrive and your body is getting ready for D-Day, that's delivery day. Here's how your body is affected. Braxton Hicks contractions. At 38 weeks pregnant, contractions are to be expected. You may have been having these for weeks now, or you may be just starting to notice what seems like 38 weeks pregnant cramps or tightening of your belly. If your contractions aren't painful and go away when you switch positions, they're still Braxton Hicks. Increased vaginal discharge. You may begin to notice globs of a thick, mucus-like substance in your discharge this week. This yucky stuff is called the mucus plug, and its presence is totally normal. It gets released as your cervix dilates in preparation for labor. Itchy belly. Your 38 weeks pregnant belly is stretched practically as far as it can go, so it makes sense that it's more sensitive. What's not normal is a rash, so let your OB know if you get one. Swollen feet and ankles. Your body will produce and retain more fluid than usual, and as a result, you may notice swelling, known as edema, in your hands and legs. To combat this, try to rest with your feet up, drink more water to help flush out excess fluid, and wear loose clothes and shoes so you feel a little more comfortable. Some moms-to-be find that wearing support hose or stockings can also help reduce swelling and discomfort. If you notice any sudden swelling in your face or hands, contact your healthcare provider, as this could be a sign of a blood pressure condition called preeclampsia. Know your signs of labor. Regular, measurable contractions that don't go away when you lie down. Contractions that become more intense and closer to one another over time. Rupture of the amniotic sac. Loss of the mucus plug. Again, this can happen weeks away from labor, but if it happens alongside some of these other signs, it's worth noting. Engagement of the baby's head into your pelvis, sometimes called lightning or dropping. Still not sure if you're actually going into labor? Call your doctor anyway. Most pregnant people, especially first-timers, will have at least one false alarm, so don't be embarrassed if you show up at the hospital convinced you're in labor, and they send you home with a big old note. It will put your mind at ease to get checked. Pregnancy checklist at 38 weeks pregnant. Finalize anything that has to be done. Think packing your hospital bag, installing the baby's car seat, and deciding who will be with you in the delivery room. Watch out for late pregnancy complications, like preeclampsia. Have your house cleaned. There's nothing better than coming home to a clean house with your new baby. Take some time to pamper and care for yourself. Wear loose, cool clothing. You're so close. The finish line is literally in sight, but there's no way to tell just how quickly you'll get there. It could be tomorrow, or it could be 3 weeks from now. Stay calm, get as much rest as you can, and try to be patient. Most importantly, pay attention to what your body is doing. It will give you clues when it's priming itself for labor. And as always, don't ignore warning signs. Always call your doctor if you're concerned about anything. Thank you for watching. Don't forget to subscribe.